Hello, everyone. Welcome back to the podcast. I'm so excited that you tuned in. We're recording live here from the Health Conference in Las Vegas. And today I have the privilege of welcoming back Taha Kass-Hout. He is the Global Chief Science and Technology Officer at GE Healthcare. Taha, so great to see you again.
Likewise. Thank you so much for having me again.
Likewise. Yeah. I enjoy having our annual reunion at Health.
That was a good word for it.
I love it, man. So just for the folks that maybe haven't heard our episodes in the past, let them know a little bit about you, your role at GE Healthcare, your background, and then the role at GE
Sure.
Healthcare.
So background, I'm a clinician, deeply rooted into evidence through outcomes. Worked also at the FDA, as the first Chief Health Informatics Officer, bringing about new technologies and ways how you can regulate those, such as next generation sequencing and providing public access to data around adverse.
By the way, I didn't know that part. So you were Health Informatics Officer at the FDA?
At the FDA.
Oh my gosh.
For 4 years.
I learned something new every time I talk
I was
to you.
actually, I had a lot of fun there. It's some awesome missionaries. Prior to joining GE Healthcare, I was the Vice President of Machine Learning at Amazon. I worked on a number of projects, including Health AI, web services, Amazon pharmacies, and a few other projects. I've been with GE Healthcare now for about 3 years. The great thing about it is really how working to see the impact globally GE Healthcare has on clinicians and patients through advanced technologies, whether that's in diagnostic imaging or tracers or even monitoring. And when we're on a mission about coupling a lot of those devices with cloud first and AI, and introduce also software as a service solutions that can ease the cognitive load on clinicians globally.
Yeah, no, thank you for that. Really appreciate the background. And yeah, in this age of data, when you have the devices with all those data streams coming from them, we have to really be thinking about how to use that data to help physicians, to help the clinicians. Where are you seeing the most impactful use of AI in healthcare organizations today?
In a number of areas, starting with the operational efficiency angle. There's a lot of discussions even here in the conference about, for example, ambient AI and how that's really helping the documentation process, giving clinicians time to back so that they can focus on patients. We're seeing a lot of work also in the billing and payments and authorization. Those are really great areas for AI to munch through large amount of evidence and data and be able to synthesize it in a way that you can now automate most of the processes and the workflows. But most importantly, this is an area where GE Healthcare is really leaning in heavily is about solving pain points for customers, whether that's at the department level, like a label delivery, or at the enterprise level. So give you a couple of announcements we made this week. First of all, we've been investing in the CareIntellect infrastructure. One big pain point for a lot of our customers is the silence of the data that sits in many systems, from your electronic medical record to your billing system to scheduling to imaging sources, and how you can bring about all of that data in a unified way so that way clinicians can spend less time navigating the system and more time spending with their patients, be informed about what's the next action they can take. We co-designed with HCA our CareIntellect for perinatal. This is a single view that brings about fetal signs, vital signs, as well as the mom, along with traces, all in a single pane of glass. So that way the clinician or the nurse will be able to have all that information at her fingertip. And then you can access that as a SaaS solution from remotely or for the handoff of care, as well as bring protocols that, that are key to that particular healthcare. So that way you can understand how we can serve those patients. This is a great area where we're finding that co-design. This is a system designed with clinicians, for clinicians across 12 hospitals, and platformization, where you're solving a lot of the heavy lift of providing a enterprise-grade security over-the-air updates, a seamless connection with all these systems from EMR to scheduling to protocols, bring all that multimodal data on a single screen, be able to structure that information in a way that gives that consistent user experience, and all tied back to the single sign-on or security and access control that the hospital system adopts. That gives a lot of confidence, especially when you're trying to make decisions or want to trace back somehow how those decisions are made, to give a lot of trust about not just the AI, but how you're really solving now concrete problems and pain points in the care and delivery area and the departmental area, so that way those care teams can truly now scale and care for their patients. Another area we're seeing AI has tremendous power is in the enterprise level. We're working with Duke Health as well as Queen's Health. Queen's Health system is in Hawaii. and where they're realizing with building on command center outcomes solution and how we're building this next generation of AI-powered hospital operations software where we can predict some of the bottlenecks within the hospital system between departments. For example, whether you can accept transfer from other facility or not. How can you streamline the patient flow from ED to other facilities or within the hospital? How can you downgrade some of those patients from high acuity to low acuity so it can take care of more patients given the resources that you have? So in a matter of about 10 months, they were able to realize about efficiencies of upwards of 22% as far as taking on more transfers. A realized savings about $20 million in that amount of time, yet without adding one single resource. That translates into taking care of more patients quickly from user experience, but also from outcomes and from operation efficiency. You can see how that really plays at scale, especially in remote areas.
Yeah, and that was one of the announcements you guys made, right? You were with Queens and...
With Queens Health and Duke Health System as well.
Yeah, that's great. And that's one of those smart hospital examples, right? Where you're able to connect all of the dots across the health system, find those areas with biggest opportunity and unlock potential.
Exactly.
Yeah.
And our approach is being on a platformization with CareIntellect platform. We're solving by integrate once with the health system, light up many use cases, bring on many apps that can solve for both operational and clinical operations and outcomes. And the goal there is when you remove the healthcare data by nature, I mean, you're dealing with deluge of data that's multimodal, meaning it can be a text, can be a EKG, can be a vital sign, can be a measurement from a lab or an image from an imaging system. So bring about all that information, be able to structure it in a secure way, have the observability and auditability over that data, who access that information, you can trace back even a decision so that way you can build more trust with those systems. All that is the heavy lift that we're taking care of. So the two examples that are brought about with the CareIntellect with perinatal on the departmental level, that was an application that was built leveraging this infrastructure. And working closely to co-design those applications with health systems gives more to the validity of the information that you're processing as well as the decisions that you're making to build even more trust with the systems. So it's not just about the technology, it's a mindset shift that goes into these, the change management that really happens. And when you have a trust in the system that's really giving back time to clinicians in a way that you can now trust it, and then we can spend in more time with that patient or even understand better, like what are the next best action that you need to take. So moving basically from insights to foresights to action, all the way from the hospital system to the bedside, is really what's delighting a lot of our customers using this approach.
That's fantastic. Yeah, no, it's exciting to hear the progress that you guys are making for customers, the providers, and ultimately the end recipient of the care, the patients. With all this innovation, Taha, it's not easy, right? What challenges have you encountered in integrating AI tools into existing systems and workflows across organizations?
Yeah, there are many challenges you have to address, but first and foremost, I'm going to always start with the problem first. Start the pain points, whether operational or clinical. Working closely with customers, we find this co-design to be a really worthwhile the effort to keep us focused on what are the issues that we're trying to solve, and along the way, help remove a lot of the heavy lifts. There are a lot of challenges in the nature of the data in healthcare. The majority of it is unstructured. And this is why today, the majority of it goes unused, because you can't structure it, right, in a way that you can analyze it and apply the AI to. The silence of these systems. So a big part of a CareIntellect infrastructure is building these open standard connectors into your scheduling system, your electronic medical record system, into your imaging system. So it can now have agnostic way about bringing about those data and have zero copy of that data for analytics, so that we can apply and bring more intelligence into that on a common infrastructure. So really, like from modularity all the way to scale. And then also keep in mind that not every health system can afford large platforms. So the way for us is take what's necessarily and build as you go. But once you remove that heavy lift, the highway, the plumbing that you're trying to kind of into all these systems, bringing new cars or new applications become a lot easier for a lot of these customers. And this is something really is delighting a lot of our customers. And then, of course, with AI, we have our own principles. It comes down to few key areas we're doubling down on. These are things we don't sprinkle on top at the end. privacy and security is job zero. This is patient data that we're dealing with,
Yes.
and the customer's data is their data. Ensuring the data is encrypted, ensuring that access to that data is also tracked, and the seamless experience. So with a single sign-on, how you can access information and who accesses that information, how everything is logged, every action, every decision, so that way we can trace back how a decision was made. Or if an algorithm is not doing what's intended, you can roll back that decision. And then all the way to providing prescriptive answers about why you made that decision, when it is augmented by AI, where is that and where is the source of that information, so that we can start building a lot of the trust with these solutions. Yes, a lot of challenges, but they're common challenges across health systems, small, medium, or large, even international. We're seeing there's the same level of complexity. This is why taking on that, not just building yet the next application, but solving for this really hard problem of the plumbing with CareIntellect infrastructure is key to our investment as we build on these delightful applications.
I really appreciate that. What about the flip side for customers, right? How are they approaching this AI governance, balance, risk, compliance? It's top of mind for many of them. A lot of times they get lost. Talk to us about that and how it affects speed to adoption.
Yeah, it's quite an evolution. If we were having this discussion last year, it was quite ambiguous. We're seeing a lot more now committees, even within the hospital worlds, that bring not only the IT staff, but clinicians, the even chief financial officer part of those decisions. You see the regulatory aspects or legal aspects of that, and all leaning in towards how can we reduce the cognitive load on clinicians, but in a way that we can build the trust in the system. As I mentioned, it's not a technology problem alone. It's really a mindset shift. And we're seeing that across the board. Of course, there's a long way to go. And for us is as we enter in any of these discussions with customers, this is for us is baked into the design about how we build these solutions from the get-go. So that way you can have the observability and traceability of every single action that you take on your data, and then be able now to trace it back to, because that's ultimately really what's going to build trust with these systems.
And in the end, it is all about trust, isn't it?
Absolutely.
Listen, Taha, this is always great to connect with you. And I always enjoy hearing what you're up to and the progress that GE is making. If people wanted to learn more about what you and the company are up to, where can they reach out?
Few things. If you're still at health, we have the booth. We have amazing work we're doing, including research. Like in last year on the keynote here,
Great booth, by the way.
Yeah, thank you. I introduced multi-agentic AI as a way to really help solve a lot of these inefficiencies around the workflow, but also go all the way as a trusted companion or an extension to the clinical team. With that, now we are evolving into also now going deeper into radiology tools that we can help from image quality all the way to understanding what's in the image to even drafting a report for radiologists. And in some areas, even how you can even figure out the scheduling, right? So you see multi-agentic is really great, even here at Health to see now the agentic AI top of mind, a lot of folks. I hope we started that revolution. We believe we're among the first to introduce that last year. So it's really great to see the power. I truly believe that's going to be industrial revolution on its own. We also have a GE Healthcare research site where we, across the company, we're always publishing about what's next coming or what are the areas that are interesting to a lot of customers globally and how we're tackling that from advanced imaging to advanced monitoring and even some of the publications we're doing on AI. So I would encourage folks to visit that as well.
Sounds great. Well, we'll make sure to get those links from Sophia.
Yep.
And put them in the show notes.
All right.
Really appreciate that. Taha, it's always a pleasure to connect with you on the podcast. Folks, check out the show notes. We will leave everything linked up there. The resources that Dr. Taha Kass-Hout shared with us, the Global Chief Science and Technology Officer at GE Healthcare. Really appreciate y'all tuning in. And Taha, always a pleasure to have you.
Thank you so much, Sal.